Good morning to our esteemed judges, finalists, and students. Welcome to the ASEAN Data Science Explorer, Malaysia Secondary School, National Final 2024. My name is Zoe, and I will be your MC for today. The ASEAN Data Science Explorer competition is a data analytic competition aimed to enhance awareness and appreciation of the ASEAN community among ASEAN youths. With the theme Today's Youth for Tomorrow's World, this competition will allow all ASEAN youths to play a key role in tackling today's social issue facing the region and help to create positive change for a better future. Using SAP Analytics Cloud and SAP Build apps, our teams today have worked over the past few months to deliver data-driven insights across 6 United Nations Sustainable Development Goals, namely SDG 2, Zero Hunger, SDG 3, Good Health and Well-being, SDG 6, Clean Water and Sanitation, SDG 11, Sustainable Cities and Communities, SDG 12, Responsible Consumption and Production, and lastly, SDG 13, Climate Action. Before we start the day program, allow me to introduce you to our esteemed panels of judges who have taken the time to join us here this morning. They are Associate Professor Dr. Wong Lai Kwan, Deputy Director of Center for Learning Excellence and Academic Intelligence, Multimedia University Cyberjaya. Dr. Liao Kong Yu, Data Scientist of Austin Services Malaysia Sdn Bhd. And Engineer Geospecialist Technologies, Dr. Nick Muhammad Zarifi bin Hashim, Senior Lecturer in Faculty of Electronics and Computer Technology and Engineering, University Technical Malaysia, Malacca. Thank you, judges, for being here with us today. We also welcome Mr. Ilan Askolani, Project Manager of ASEAN Foundation SAP Joint Initiative, and Ms. Ratia Ayun Nintias, Executive Support and Administrative Officer from ASEAN Foundation. To kick us off, we are pleased to have Mr. Ilan to deliver the opening remarks.
A very good morning, everyone. Distinguished judging panels, ASEAN DSE National Finalists, ladies and gentlemen. It is my great pleasure to welcome you all to the ASEAN Data Science Explorers 2024 National Finals Malaysia for secondary school category. I'm very happy to see so many of you today. It is admirable to see how dedicated and driven you are in providing an innovative solutions towards tackling the pertinent socio-economic issues in ASEAN. This year, we received so many insightful and eye-opening storyboards, which made the selection process very challenging. For that, I'm so excited to have our amazing line of judging panelists with us today. I trust that their expertise and knowledge will help adequately determine the top 3 teams in today's competitions. With that, I would like to take this time to show my appreciations and admirations towards all participating youth in this year's ASEAN DSE competition. Thank you for your dedication and showing us your passion towards building a better ASEAN. Keep working towards that goal. I cannot wait to see what future holds for all of you. The ASEAN Data Science Explorers, or ASEAN DSE, is a perfect example of public-private partnership that results in tangible outcomes in partnership with SAP. We have implemented this program since 2017, and we have achieved incredible accomplishments together. In the last 8 years, this program has empowered more than 71,000 youth and 3,300 educators from 868 institutes of higher learning and 228 high schools across the 10 ASEAN member states. This program has proved its amazing impact on the lives of participating youth, as 78% of them considered the skills they learned from the program important in their current work and career progression. 82% of them were able to apply the problem-solving and critical thinking skills they learned from the program onto their real life challenges. So those are the concrete outcomes and impacts of this program on the youth, yeah, on the improvements of the skills and the career of the youth participating in this program. This year, we have dedicated the competitions towards finding solutions for pertinent ASEAN. The focus issues such as climate change, sustainability, and economic growth contributing to the achievements of the UN SDGs. It is our goal that this program not only steer youth into becoming better and more efficient problem solvers, but also to equip them with the skills to understand current issues in order to effectively come up with motivated and innovative solutions. I'm happy to say that every year the ASEAN DSE program gets bigger and more inclusive, thanks to the strong commitments from our main partner, SAP. Equally, we couldn't have continued to make such amazing impact without the support from the Ministry of Education Malaysia, College Nikatan 6 Tun Fatimah, all our higher education institutions and secondary schools in Malaysia that have partnered with us. I also want to express my sincere appreciation to our esteemed host partner, Multimedia University, for your support in providing us with the venue and resources to make this event possible. And to all the national finalists today, congratulations on your achievements. I hold such strong admirations for you all. Keep that patience and drive towards a better future for your community. I wish you the best of luck with your presentations. Thank you very much.
Thank you, Mr. Ilan. Before we start the competition, I would like to remind our finalists and judges on the format and rules of the competition. Each team will have 6 minutes of presentation time, followed by 4 minutes of Q&A session. A bell will ring once when you are 1 minute from the end of your presentation time, and will ring twice once your 6 minutes is up. Let's begin with the first presentation by Team CP Squad from SMJK Yokbin, Melaka.
Mic test. Mic test. Imagine waking up in 2050, stepping outside to find our city under an intense heat wave.
I cannot tahan already. Every day also hot one.
Streets are empty.
Hey, where's the people? Where is it? Why is no one here?
Hey, stop complaining lah. You are the root cause of this problem, you know.
Huh? Me?
This isn't just a dystopian vision. It is a potential reality if we don't address global warming now. Good morning, everyone. We are Team CP Squad from SMJK Yokbin in Melaka. I'm Xiang Ping.
And I'm Jia Qi.
Today, we will be talking about global warming from fossil fuel. As shown on the slide, the Asian region has been facing a significant rise in average temperature over the past 2 decades. This is due to the increase in greenhouse gases in the atmosphere that leads to greenhouse effect. Thus, global warming occurs. At the current pace of carbon dioxide emissions, scientists expect there is an increase of 1.5 degrees Celsius to 5.3 degrees Celsius in average temperature by 2100.
To prevent harmful consequences of global warming, the world needs to cut emissions by 7.6% every year. This is the impact of global warming by 2100. Scientists expect there is 87 million flooding at low-lying areas,
70 centimeter rise in sea levels,
and 6.7% of GDP loss each year. The problem statement is clear. We need an immediate action to reduce greenhouse gas emissions to combat global warming.
So, what are greenhouse gases? It is the gases in the Earth's atmosphere that traps heat. Carbon dioxide accounted the total greenhouse gas emission the most, which is 80%, followed by 11% of methane, 6% of nitrous oxide, and 3% of hydrofluorocarbon.
Carbon dioxide is released through burning fossil fuels, deforestation, and agriculture. The common fossil fuels are petroleum, natural gas, and coal, which is the main source of global energy consumption.
This graph shows the total carbon dioxide emission by sector in Asian countries in 2022. We can see that electricity generation and transportation are the main contributors to the carbon dioxide emissions.
This chart shows the number of registered vehicles in use per 1,000 people in Asia. Malaysia has the highest car ownership among ASEAN countries.
Malaysia's transportation sector strongly relies on fossil fuels, which is petrol that accounted 88.3% as compared to renewable energy such as 2.5% of hybrid and 1.2% of electric only as fuel sources.
This graph illustrates the relationship between the number of registered vehicles and carbon dioxide emissions in ASEAN in 2022. Indonesia, Vietnam, Thailand and Malaysia have high carbon dioxide emissions as they have a high number of registered vehicles. From this, we can conclude that more private vehicles leads to higher carbon dioxide emissions and increased temperatures. Even if carbon dioxide emissions were to suddenly stop, Earth's temperature required thousands of years to cool and return to the level in the pre-industrial era. We must act now to reduce the number of vehicles on the road.
Jiaqi, to solve this problem, let's just encourage people to use public transport instead.
Hiya, Xiangping, but the buses are often late and inefficient. Driving my own car is way more better.
Then do you have any better ideas to solve these problems?
Of course! Introducing the extraordinary, remarkable, intelligent mobile application, Poop House, that can solve the root of this problem.
Oh, I know. Poop House is a carpooling service that allows drivers to give a lift to riders heading the same way. Or it's not that 4 persons in one car is more environmentally friendly than 4 persons in 4 separate cars.
The advantages of Poop House are reduce the number of vehicles on the road,
act as a cost-saving strategy,
raise public awareness,
and most importantly, it is a quick impact project. Poop House is efficient. To reduce the number of vehicles on the road, just click Share a Ride button. Users can get a ride in any area at any time with a low rate of cancellation. It avoids crowds and parking problems.
Poop House is a cost-saving strategy. All the costs are shared among the passengers, making it cheaper than a personal taxi service or owning private vehicles.
To raise public awareness, click Carbon Footprint button. You can track private vehicles' carbon footprint from a petrol usage and get a reduction plan to encourage sustainable transportation.
Xiangping, what if users ignore the reduction plan?
No worries, Jiaqi. Pool House offer incentive through pool price. Users can claim token for reward to motivate more participation in emission reduction.
This is the implementation plan of Pool House from 2025 to 2035. We'll prepare with app customization, partnerships, and pilot programs in the first phase. In 2027 to 2028, Pool House will roll out in Malaysia with strong marketing. After that, we will expand our available area and to be improved. Electric vehicles will be fully operational by 2031. Finally, complete ASEAN penetration by working with local councils and partnerships. Pool House is set to achieve the AEC and SCC Blueprint 2025, SDG 11,
Sustainable Cities and Communities,
and SDG 13.
Climate Action.
Pool House has a big impact in ASEAN by 2035. Pool House aim to reduce 20% carbon dioxide emissions,
30% decrease in reliance on fossil fuels,
reduce 10 million daily vehicle trips to 7 million,
and achieve 40 million active users across Asian countries.
Pool House requires moderate investment, a short construction period, and it is a quick impact project. Pool House is the no-regrets options towards a net zero future and simultaneously make us and the planet healthier and happier. Leave your car at home and start using Pool House. Thank you.
So the presentation time is end. Judges, you have 4 minutes to ask the question in Q&A session. So.
Hello. Oh. Wait. Hello. Um, Hello. Hi. So thank you for the presentation. That was very good. I think that sets a bar for a lot of other teams here. I don't have much comment. I do have one inquiry on slide 14.
Slide 14. Sorry.
I will stop you when you go. It's quite in front. More. It's where you show different countries with two bar charts. Yep, this one. I just want to ask if you created this slide, this plot yourself.
No, we find the data from this ASEAN States Data Portal. It shows the carbon dioxide emissions, and also we find the number of registered vehicles in all ASEAN countries, and we combine it together to form this combined graph.
Okay, so you got the data from somewhere else, but you create this plot yourself.
Yeah.
I just have a small comment. I think it's good that you show this, but if you are showing number of registered vehicles and also total carbon emissions, right? These are two different metrics, and if you put it together like this with absolute numbers, you will get very weird graph. Ideally, you should be showing two different axes, so you won't get, let's say for Laos, you have a two number of registered vehicles, but you can't even see it here. So yeah, so it's better to have two different axes. This is just my comment.
Okay,
Thank you.
From my side, there will be several elements. I just want to check what is your expectation on how to spread the awareness for the green gas impact to society until 2035?
So for this, we will make the awareness campaign. By doing awareness campaign, we can raise the awareness of the public about the urgency of this global warming, these issues, and also the urgency, the seriousness of the number of registered vehicles in Malaysia in all ASEAN countries is constantly rising. So we will spread this to the public, to the communities, so that they can trust us and use our apps. Another thing is that we will explain very detailed for them in the campaign so that they can know what is our cost-saving strategy. Since we know that it's a big decision for them not to drive their own car, but to use our carpooling app in their daily transportation. So we will definitely promote by this to the public so that they can know that this is a very cost-saving, it's a very fulfilling method for them to use our app. And another...
Okay, right. Next one is, can you go to the forward slides, please? Until the expectation percentage afterwards, 2035. So there will be...
the implementation plan.
The impact.
The impact percentage.
Okay.
So I just want to check you say the four domains over there, up, down, this one.
Okay.
So how you estimate the minus 20%, minus 30%, 7 million and 40 million? So by roughly or having some sources, or how you calculate them?
Okay, for this, for the carbon dioxide emissions, we base on the Paris Agreement. Malaysia have signed the Paris Agreement, which they target to reduce 45% of the carbon dioxide emissions. And for Malaysia, we have increased the carbon dioxide emissions from 2018 increased for 1.42% from 2018 to 2019. So we definitely didn't reach the target. And for the daily vehicle trips, we use the ASEAN. There's an ASEAN report that's called Current Status of Public Transportation in ASEAN Megacities. They shows that the average daily vehicle trips in ASEAN has 10 million to 50 million daily vehicle trips. So by this, we set a target to reduce to 7 million, which can reduce 30% of the daily vehicle trips and so the fossil fuels.
And because to add on, we have do research and average passenger vehicles trips emits 400 grams of carbon dioxide per mile. So let's assume every passenger vehicle trips goes for 1 mile, so it already emits 400,000 grams of carbon dioxide, of carbon dioxide. So it's definitely everyone will travels for more than 1 mile, so it's already emits more than that. So for decreasing 10 million to 7 million, we have already decreased 30% of daily vehicle trips, and so to 30% to fossil fuel use. And for the user adoption, we have referred to other apps that is similar to Pool Pulse, which provide transportation service, which is Grab, because initially they have set a target to achieve 60 million of active users. So since we are a new launch application and also in this competitive market, so we have set a slightly lower target, which is to achieve 40 million of active users across Asian countries.
Okay, thank you. So
Can I ask one more? So it's just a suggestion. I guess you should note some sources, recitation or citation at the bottom of your slides. So that's all.
Thank you.
Thank you.
Okay, so thank you, Team CP Squad. Please return the mic here. Okay. Next, we move on to Team E plus Pi from SMK Tinggi Kuching Sarawak.
Testing, testing. Ten seconds. Many things can happen in a span of 10 seconds.
According to the World Health Organization, 26,300 people die of cancer every day worldwide.
Everyone, let us count down for 10 seconds together. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1.
Boom! Approximately 3 people across the globe have just died of cancer. Will there ever be a cure?
Greeting to our honorable judges and our dear listeners. My name is Jiaying.
My name is Esther, and we are Team E plus Pi. Today, it brings us great honor to stand here today and shed light upon an important issue through our presentation, Combat Cancer.
Cancer is one of the leading causes of death, not only in Malaysia, but all Asian countries too. Based on the graph, estimate number of new cancer cases from 2022 to 2045, Indonesia ranks on the top in the list.
Yes, now take a look at the red bars. It is clear that the cases are increasing every year. The highest figure is almost up to 4 million. Therefore, we must take action.
Moreover, from the next graph, we found that breast cancer, colorectal cancer, and lung cancer are the top 3 common cancer which is faced in Asian countries.
Exactly. Now, based on our findings, we have identified 3 problem statements. Number 1, unhealthy lifestyle choices. Many practice bad lifestyle choices that harms their body's immune systems against cancer.
Second, living in denial. Many neglect to proceed in thorough medical checkup due to lack of awareness, stigma, or high medical costs.
That's right. Now, based on this graph, it is found that Singapore's medical costs are rising each year. This decreases subsidies for healthcare. And lastly is the psychological impact. Cancer diagnosis and treatment can cause significant mental health challenges for both the patients and their families.
Moving on, one of the causes of cancer is limited awareness and late detection. From the graph here show that Philippines have the highest mortality rate in Philippines is up to 11,200,000.
That's right. Now, the second cause is lifestyle choices. Smoking is one of them. Indonesia happens to have one of the highest smoking rates globally. Therefore, it is detrimental for their health as smoking is a major risk factor for oral, lung, and other cancers. Isn't that right, Jiaying?
Yes, that definitely is. But don't worry, FV has come out a few helpful recommendations to help us to combat cancer together.
All right, but before that, let's start off with our objectives, shall we?
Of course, our first objective is increasing the awareness of cancer among the public community.
Second, we also aim to promote supportive care for our cancer patients.
Last, promoting healthy lifestyle choices is our objective too.
And all of this ties to our star SDG of today, which is good health and well-being. More specifically, Target 3.4.
Next, our plan to combating cancer are simple and true two ways, which are raising awareness
And developing cancer support systems. Now, how will this be done?
First, we will start raising awareness via education sector first because we want to encourage student involvement in collaborating with local cancer society. Here is our suggestion.
Exactly. We put a lot of focus on student involvement as students are our future generation and we have the power to make a change too. For instance, in order to test the feasibility of our solution, we've personally reached out to our local cancer community, SCAN. We met up with their president, who's enlightened us on some of the issues that they're facing and how we can help them. Next, we started out our online platform through our interview session, which is We Ask, You Answer Questions on Cancer, to test our friends and teachers' understanding on cancer and raise awareness from there.
Yep, so this is our interview video. If you are interested, you can watch it on YouTube via the link. Next, we are proud to propose an app called Combat Cancer, which one-stop information center on cancer and across the entire ASEAN.
That's right. So here is our prototype. It consists of 6 main functions, and if you're interested, you can download it via our website.
Yep, so this is our welcome page for you to select your country and which will lead you to the homepage.
And now we move on to our top 3 functions of the app. Number 1 is the booking system. This serves as a source for the public to access screening tests easily, and we aim to minimize late detection via our booking system.
Our next function is the info system. We include this function because we want to help our user to get the information in one spot, which is more effective as compared to scrolling website online.
And lastly is the community tab. Based on our interview, we found that half of our interviewees are not aware of the nearby cancer communities. So with this in hand, we hope that we are able to enlighten the public that they should never be afraid when they're diagnosed with cancer because there are plenty of support communities ready to help.
Yeah, so this is our implementation roadmap. We are now currently in phase 2 and we aim that by 2026 we can expand our app to to all ASEAN countries. So this is our key impact that we aim to achieve from these blueprints.
In conclusion, cancer is a disease that should never be taken for granted. Therefore, let us all do our part in increasing our understanding and awareness on cancer because awareness today is a cure tomorrow, and together we are stronger than cancer. Thank you.
The presentation time is end. So for participants, please stay one mic to on and another one please mute off to prevent the echo. So just stay one mic. Okay. So judges, you have 4 minutes to start the Q&A session.
Okay, thank you. I think it's a very interesting presentation and yes, some innovative solution. So back to your booking system. So how do you plan to work with, do you plan to link it to hospitals, clinics and so on? What's your strategies? Because there are so many clinics and hospitals around and how do you identify the suitable clinics and so on?
Yes, we aim to partner with all of the hospitals. We're starting with Malaysia first. So as we've mentioned on our implementation roadmap, we're currently on phase 2. So we will be proposing our app and we'll see if any hospitals they're interested into partnering with us. So we would place their database onto connect their database to our app, and that way we can work with the booking system from there.
So which means your booking app will allow the partners to register themselves in the system?
Yes, we will allow the users to register themselves through our booking system right here. So this is the user's interface. So they can select either a booking or a buddy to accompany them. And once it is done, this would be the page. There is an admin page for the hospitals, so they are able to track the bookings from there.
Okay, I think at least there's a more sustainable solution. So back to a very basic question. So because your objective is to combat cancer, so is it more to prevent cancer or is to also, the combat here, what do you mean? Because you're trying to develop cancer support system, right? So that is actually to address issues if people already have cancer. So maybe you can elaborate clearer on your objectives.
We believe that in order to combat cancer, we need to start by raising awareness. So many people, they may not be aware of detection. So we hope that through our solutions here, through our app, that it will be able to educate the public on how they can get treated and all of the information that they need to know. So in that, we will be able to combat cancer together through awareness.
Okay, so your cancer support system is more for raising awareness and not so much of supporting existing cancer patients, is it?
It will support cancer patients as well because we have the care line function as stated here. So many cancer patients, when they're diagnosed, sometimes they don't have a source to share their feelings. They don't have someone to vent to. So we hope that through this care line, which will be supported by volunteers, they will be able to get help or have someone that they can trust or speak up when they need any help.
Okay, I see. So there's quite a holistic solution. Maybe the name of your system, because it's a cancer support system, so the name may have to be, because it encompasses both raising awareness as well as the support assisting.
Yes.
So the name have to be more appropriate to avoid misconception on the purpose of the app. I think that's why I pass to the next judge.
It's just a comment. I think the interview session that you have done, I think it is being impactful for the studies. Thank you so much.
Thank you.
Okay, so the Q&A session has ended. Thank you, Team E plus Pi. I would like to invite Team H2O from SMJK Yok Bin, Malacca.
Mic test. Mic test.
Once upon a time, there were two girls from Team H2O. That is me, Jinghui.
And me, Xinghui. We are having a picnic beside a river.
Ouch! My stomach hurts.
What have you done just now?
I accidentally drank a bottle of brown smelly water.
And the story entitled Retrieval of Safe Water and Sanitation begins.
Unsafe water sources have caused health risks and spread diseases in ASEAN countries. Here comes a problem: how to retrieve safe water sources for ASEAN citizens.
According to the graph of global and regional drinking water coverage, in 2015 to 2022, at least 21% of population in Southeast Asia region that is still exposed to contaminated drinking water.
For sanitation coverage, as high as 36% of the population in the Southeast Asia region still lack safely managed sanitation.
The factors that contribute to unsafe water sources are water pollution,
Socioeconomic factors,
environmental factors,
human activities,
natural contaminants,
inadequate infrastructure,
transboundary water issues,
and lack of enforcement.
Industrial discharge is one of the main causes of water pollution.
This graph shows the number of industrial parks per state in Malaysia in the year 2019. We can see that Selangor, with 16 industrial parks, has a BOD level of 11.1 milligram per liter, while Sabah, with only 3 industrial parks, has a BOD level of 1.1 milligram per liter. We can conclude that the more industrial parks there are, the higher the average BOD level of the water sources, which means the water are more polluted.
Not to mention, according to the graph of percentage of population practicing open defecation per country, 32% of population in Laos, 27% in Cambodia, and 13% in Myanmar are still practicing open defecation.
That means the river in front of our eyes may contain tons of fecal waste. Ew, that stinks.
Yes. Moreover, poverty is a socio-economic factor that contributes to unsafe water sources. Based on the graph, Laos, which has a lower GDP per capita, has the lowest share of population using unsafe water sources.
On the contrary, Singapore, which has the highest GDP per capita, has 100% of the population using safely managed drinking water. We can conclude that the lower the income of the country, the lower the percentage of the population using safely managed water.
Are you wondering about the impacts of unsafe water sources? Unsafe water sources significantly contribute to the spread of waterborne diseases among ASEAN countries.
Next, unsafe water sources cause high mortality rates in ASEAN countries. Based on the graph of death rate from unsafe water sources in year 2019, 9 ASEAN countries have death rates higher than the average death rate from European countries. That is 1.3 deaths per 100,000 people.
Referring to the case study of causes of death in children under 5 in Indonesia, in 2021, diarrheal diseases, which are mostly caused by unsafe drinking water, has ranked number 4 among 38 causes of child death.
This graph shows the diarrheal disease death in ASEAN countries, where Indonesia has the highest mortality rates. There is 18.31 deaths per 100,000 people.
Now, we have proposed 3 solutions to solve the problem stated. They are small-scale and large-scale water treatment systems, along with our mobile application.
Solution 1 is the small-scale water treatment system, which include household water treatment and safe water storage. While solution 2 is the large-scale water treatment systems, which include drinking water treatment system and membrane filtration system to treat wastewater. Now, here comes our solution 3, our very own application, the one and only
Drum roll.
Hike to Oasis. Xinghui, as I'm a new user, can you tell me how to use the app?
Sure. Even when nobody is here to explain how to use the app for you, you could click on more information to learn more about how to use Hike to Oasis.
What if I drank a bottle of brown smelly water and I'm having a stomachache? What should I do next?
Just click on Symptoms Checker, take the conditions of your drinking water, for example, cloudy. Next, select your symptoms and click Submit. You'll be provided with a list of possible diagnoses based on the symptoms given.
What if I want to complain about the brown smelly water?
No worries. Just click on Make a Report, then fill in the form, add your location, and add a picture of the unsafe water source, and you're done.
Wow! To add on, I can also learn more about water by clicking on the Learn More button.
The benefits of Hike to Oasis are early detection and diagnosis,
Public awareness and education,
data collection and monitoring,
and integration with health systems.
To put this final solution into action, we will first initiate our ideas in 2024. Followed by that, app development starts a year later in 2025.
In 2027, a test run will be carried out to refine the app based on the reviews collected. Partnership engagement with water authorities in ASEAN region will be carried out in 2029. Finally, Hike to Oasis is primed for public usage in 2030.
Our mission is to achieve 2 Sustainable Development Goals by the year 2030. They are Goal 3, Good Health and Well-being, and Goal 6, Clean Water and Sanitation.
Our solutions also comply with the ASEAN Social Cultural Community Blueprint 2025 and ASEAN Economic Community Blueprint 2025. In the end, everyone lives happily ever after with safe water
and sanitation.
Cheers!
6 minutes is up, so judges, you can proceed to Q&A session.
Hi. Thank you for the wonderful presentation again. I wanted to ask something that I read, but you sort of briefly skipped through actually. Page 25. House water treatment in different regions. This one. I actually don't understand this plot. Could you explain a bit? Thank you.
We can see that the household water treatment practice in the Southeast Asia region is, in all region, is mostly the boiling method to treat their drinking water. But in Southeast Asia, chlorination and solar disinfection is still lack of practice by the public to treat their water. So especially in those rural areas, if they do not practice this household water treatment system, they cannot access to the safe drinking water to drink.
Okay, then I think I understand now, because I was focusing on the boiling part, but you were saying that higher chlorination implies better house water treatment. Is that what you're trying to say?
No, we're encouraging every method. So, like with low income, they can try to use boiling method. But if you have the money to afford your water treatment, then use other method instead to increase your purity of water.
Okay, I guess if every method here are good, then I think Southeast Asia is actually doing okay compared to other places. It seems to be average here. I mean, it doesn't seem to be lacking of practice. I don't know, in my opinion. Yeah. Maybe this plot is not good enough to prove a point, I guess.
For me, I think, can you open up your apps features? So the one thing I would like to ask about data collection and monitoring. So that one. So can you explain a bit about data collection and monitoring? So because how are you gonna monitor person at home instead of via using the apps?
By data collection and monitoring, we actually mean that the data collected by making a report, the users, when they make a report, their data will be stored in a server of the app, and then the local water authorities will be able to retrieve the data with an admin account. And then they'll use the data to track the patterns of the unsafe water sources, and then they will try to solve the problems by actually targeting the locations of the unsafe water sources.
Okay, that one is speaking of data, private and confidential stuff. So what do you think about the red box and the blue box linking each other in order to stick to the stakeholder? What are your stakeholder over here for the red and the blue?
The stakeholders are actually the local water authorities that we are going to collaborate with, which are the local water authorities of the ASEAN countries. And Ministry of Health, but we are actually targeting only the water departments.
Is it time's up, or can I still have time for one question?
Okay, yes.
Okay, maybe you go to slide 5 in the beginning. No, further down the charts. Before. Okay, I think, yeah. So I think for this chart and the previous chart, I have a question that is similar to Dr. Liao. So in this case, if you could see the steepest climb in terms of improvement of safely managed water is actually in Southeast Asia. So that means there's some good efforts already put in. So did your team actually look into what are the existing methods that are working effectively that leads to this a significant increase, and how would your approach actually complement the existing efforts?
There's already a significant increase in the sanitation system, but there's still lack of sanitation system in those rural areas in the ASEAN region. So we have put forward 3 solutions, especially if it's in rural areas, then we'll try to encourage the practice of household water treatment. And the government bodies have to install the water filtration system for their citizens, so that the rural areas can also obtain good sanitation systems for their citizens.
Okay, thank you.
Can I just add on a little bit? I think you are. That could be a good reason. But from this plot itself, one very obvious potential reason is that that thing is actually Eastern and Southeastern Asia. It's not really Southeast Asia, is it? So Eastern Asia comprise also, Japan, Korea, and China. So maybe those countries have already boosted up those numbers. So if you want to prove your point, I guess showing Southeast Asia is better. Maybe that could be a good start, I guess.
Okay, so thank you, judges, and thank you, Team H2O. Please return the mic here. Thank you. Next, I would like to invite Team Mango Meal Alliance from SMK Convent Teluk Intan, Perak.
Mic test, mic test.
Mic test, mic test. Good morning, everyone. We are the Mango Meal Alliance from SMK Convent Teluk Intan. My name is Lu Haoyan.
And I am Wong Xiang Yi.
Today, we are very excited to present our initiative to combat child mortality. To begin with, let's understand what child mortality is. Child mortality refers to the death of children under 5. It is a critical health indicator as it reflects a community overall health. It is also measured as the death per 1,000 live birth that is often caused by prematurity, infectious disease, and malnutrition.
Therefore, reducing child mortality requires effective healthcare and preventive measures. Now, let's look at the current situation in ASEAN countries. Specifically, Laos and Myanmar have the highest neonatal mortality rate.
But why do Laos and Myanmar has the highest neonatal mortality rate? Let's delve deeper into the common causes of child death. Prematurity, infectious disease, and birth complication are the leading factors.
These issues are exacerbated by insufficient healthcare services. Therefore, improving healthcare infrastructure are vital to these regions. In many regions, basic sanitation services still remains as a significant problem. This is especially true for countries like Myanmar.
Poor sanitation can directly impact child health, contributing to higher child mortality rate. Thus, improving this service is very crucial for reducing preventable death and enhancing overall public health. This slide shows the UHC service coverage sub-index for reproductive, maternal, newborn, and child health in Southeast Asia.
Myanmar and Laos have the lowest score at 56 and 60 respectively, whereas for countries like Singapore and Brunei, they score much higher. This indicates that there is a need for healthcare improvement in those regions.
High child mortality rate in Laos and Myanmar are a major issue due to poor UHC service coverage and basic sanitation. Many child deaths result from preventable conditions like preterm birth and respiratory infections.
We aim to develop an app to reduce child mortality through collaborations with government and also the community.
Yeah, to address the challenges identified, we recommend the introduction of an innovative app, that is Medcare2Go.
This app will serve as a comprehensive health management tool, empowering users to be able to access helpful resources and also knowledges. Now, let's look at the features of our app. Our app includes an information hub, a symptom checker, a healthcare locator, and also a feature called Contact a Doctor.
Not only that, the app interface also includes the sections for profile management, setting, and reminders.
The Information Hub offers trusted health topics regarding symptoms, vaccinations, and also overall well-being.
Not only that, a symptom checker also helps users to analyze their symptoms and decide if they need medical advice. This feature is especially useful in remote areas.
This is the healthcare locator. It helps to locate nearby healthcare services such as nearby clinics, nearby hospitals, and nearby healthcare facilities. It can ensure users to be able to access services they need at all times.
Not only that, Contact a Doctor feature also connect user with certified doctor to get direct medical advice and prescription.
This QR code shows the demonstration of our app. If you are interested to see how our app works, you may scan the QR code above.
This is our implementation plan. Our implementation plan includes testing and launching the app, as well as after that gathering the user feedbacks.
We also aim to expand our app's features and achieve the SDG 3 goal, which is good health and well-being by 2030.
Promotion and collaboration are the key to our success. Thus, we plan to partner with local hospitals and promote our apps through ads and posters.
Additionally, we will also collaborate with government and private organizations to broaden our reach and enhance our credibility. So, in conclusion, our initiative aims to reduce child mortality through our app Medcare2Go. As we move on with our project, remember, access to healthcare is not a privilege. It is a fundamental right for each and every one of us. Let this guide us in our future mission in making a huge difference in the life of those who need it most. That is all from us. Thank you.
Okay, so 4 minutes Q&A session starts now.
Okay, one for me, basically regarding to the button of Contact Doctor. Can you show the slides? So recently in Malaysia, we heard about not legit doctor has been being a doctor at Hospital Putri Sultana. What was the name? Last week in Malaysia, teenager become a non-legit doctor pretending she's a doctor. So what is your opinion how to track the legal doctor connecting into your doctor, Contact Doctor? What is your strategies?
So we will only collaborate with certified hospitals that are considered more well-known. That way the community would be more trustful of us. And because doctors from more trustful hospitals are definitely certified, so I don't think that is a problem.
Okay, thank you for the presentation. I think the charts are good, it's clear. But I do have one very fundamental question, because from the visualization and the charts, it shows that the key countries that are having issues are Laos and Myanmar. And as far as I know, Malaysia, the mortality rate is really low. So my fundamental question is that how this solution will benefit all the ASEAN countries. Seems like from the presentation, it kind of like focused very much on the two countries, or highlighted, this is the problem in those two countries. Really actually help much, like let's say, for example, in Malaysia and so on?
First of all, we will also expand our app's features. For example, we will add more languages to it, so the app can be used in any countries in ASEAN. And we will also collaborate with cultural professionals so that we can be more in touch with different cultures. So that way, our app can be used anywhere.
Sorry, I think my question is actually the key countries that are having problems are Laos and Myanmar, right? So you are trying to create an app to solve the child mortality problem. So at the very first place, why you choose this problem to solve? Because Laos and Myanmar are the countries having problem, but most of the other countries may not have a serious child mortality problem. So how this solution could, because it's for ASEAN, right, could actually benefit all the countries?
For our app, also like the feature, a symptom checker, it's although it is mainly for the maternal and newborn, but it also has other symptoms that you can use the app to check, so the public will more understand their health condition. Yeah.
And why we chose to make this app is also to make sure we can reduce child mortality, right? So by reducing child mortality, we can ensure that the future of ASEAN countries will be better, because young children are the future of our generations.
Okay, thank you.
So since we have time, does any judge need to give some comment?
If you have time, yes, I can. I actually have some notes, but the slides are not up now, so it may be a bit harder to explain. In page 5 and 6, you were talking about the basic sanitation services, in every country, and also the UHC, right? My personal opinion is that it's harder to see that it's harder to imply that lower basic sanitary services or lower UHC corresponds to higher child mortality rate. What I'm trying to say is, if you want to prove a point, I think it's better to show some sort of correlation plot, right? You have the numbers for child mortality rate, right? So you could plot them, maybe let's say your x-axis is the UHC services, and then your y-axis is the child mortality rate. Then that way it's a bit easier to understand from my perspective.
Thank you.
Thank you.
So thank you, judges and Team Mango Meal Alliance. Next, we move on to our fifth team, Team Nutri Warriors for SMK Tinggi Kuching Sarawak. Mic test.
Mic test. Mic test.
Do you ever think of the food that you eat can either be the most powerful form of medicine or the slowest form of poison? Greeting to all the judges and fellow audience. Today, we are going to embark on a unique journey, a journey into the world of
Food paradise. I'm sure you are excited about what poison and medicine exactly mean. Instead of medicine, we decided to look onto poison because we are Team Nutri Warriors. I'm Huang Ming-en, and this is my partner Sharon. Before we start, let me briefly explain what malnutrition is. Malnutrition refers to the deficiencies, excesses, or imbalances in a person's intake of nutrients and energy. Malnutrition is categorized into two categories, which is overnutrition that consists of underweight and undernutrition that consists of stunting and wasting.
Based on the graph, we can see that the percentage of obesity in Malaysia is the highest, which is 29.8% if compared to wasting. Therefore, we choose to focus on the issue of obesity. Among the several causes of obesity, high calorie intake has the greatest mean value.
Talking about high calories, what do you think of? The first thing that will pop in our mind will definitely be fast food. Just a quick question. How many times have you consumed fast food in a week? If your answer is 1 to 3 days, then you are definitely one of the contributors of the frequency of adolescents eating fast food. Based on the two graphs above, we can see that the range of calories intake per serving for fast food is the way higher than nutritional food.
The problem that we propose today is unhealthy eating habit raises health concerns, especially obesity, due to the high calorie intake. To cope with this problem, we are going to propose our dazzling app, Nutrigen. Our app is called Nutrigen because we are Nutri Warriors.
We are the next generation to engage in the world of malnutrition.
Our app consists of 6 features. The main features calculator enables users to calculate their daily calorie intake. If their daily calorie intake exceeds the optimum value, the user can navigate to the Nutrigen menu for healthier food option through the button.
The third feature is the food scanner. User can scan on the QR code provided on the food and drink packet to understand the ingredients and calories of the food. Feel free to scan on the QR code provided for more detailed nutritional info. Besides, our app also consists of booking, health assessment, and info page. We use an app called Naluri as reference. By comparison, Nutrigen is more efficient than Naluri.
Moving on to the second solution, by using the choice concept menu, which is scalable in ASEAN country, the user can decide the quantity of food that they eat for healthier options by referring to the calories content and nutritional details on the food. Based on the study of ERS in the fast food restaurant shows the efficiency of choice menu. This Nutrigen food menu is the menu that we modified based on our school canteen. A demonstration had been carried out in our canteen and classroom. We explain the Nutrigen menu to the student while they are eating and also distribute the menu to all the classes. As a result, we get much feedback from them.
Moving on to the third strategy, Nutri Warriors workshop that is specifically organized for secondary school students. This workshop is collaborated and presented by young professionals such as dietitians and nutritionists from other countries to promote the importance of proper eating habit. For example, by following the Suku-Suku Separo chart set by Malaysia Health Ministry. Based on participants' feedback, we can see that carbohydrate is chosen as the main class of food before they attend the workshop, while protein is more preferable by respondents after they attend the workshop. We also seek for respondents' response regarding their desire to share this workshop to others.
Lastly, Student Health Gateway Program with student, school, and health officer as stakeholder. By tracking the result of Ujian Sega of student, the school will refer the overweight and underweight student to the health officer through the nearby clinics.
In this program, medical officer will provide information for students. Next, students are required to implement a one-week web management plan. After that, medical officer will provide suitable meal plan for students according to their situation. Starting from phase 1, we start to gather idea from secondary school students toward SDG2 and 3 on ADSE competition by partnering with SAP. Next, we undergo partnership and collaboration with various stakeholders. After that, we collect feedback for further improvement. Lastly, our app will be uploaded widely at Play Store to be used widely.
In the end, we are going to aim SDG 2 with target 2.1 and 2.2 and SDG 3 with target 3.4, whereas these are the indicators to achieve for SEC and AEC Blueprint 2025. In a nutshell, the only key issue that we are going to cope with is obesity. By proposing this 4 strategy,
we hope in one day we can say bye-bye to obesity. That's all from us. Thank you.
Judges, you can proceed to Q&A session.
Hi. Thank you for the presentation. Very nice workshop as well, by the way. I have questions about your data presentation, if you don't mind. Can you please go to page, let me see. Let's say page 4. Yes, this one. 138% of boys and girls. What does that mean?
For this, we use stack column graph. The percentage of boy eating fast food for a week at 1 to 3 days is 67.3%, and for girls is 71.3%, and this is the total frequency. So we represent it in this chart.
Okay. Yeah, I think you also realize something is off here. So if you show this as a stacked bar chart, then you'll get weird numbers like this: 138.6% of boys and girls. It doesn't make sense at all, right? Yeah, I mean, biological standpoint, you have boys and girls. Then if you total it up together, the total is 100%. You cannot get 138%. So if you want to show that 70% of boys and then 67% of girls, right, or vice versa, then you should put it side by side, not stacked together. And the same problem happens for the previous slide, the previous one, and this one as well. It's the same implication. Okay, so perhaps be a bit careful. The other inquiry that I have is page 19. This survey that you did after workshop, or before and after. I'm a bit suspicious, I have to be honest. How can you get people to say, before the workshop they had like 57% of carbohydrate, and then after that becomes 4.8? That's a bit weird. So I need to understand how you collect this data.
This workshop is actually organized by the one of the university, which is IMU University, and we are one of the participants of this workshop. Before this, we plan to conduct a survey for those participants who joined this workshop. So this is the survey that we created ourselves, and we require them to choose the main class of food, not like how many percentage of carbohydrate they consume before they attend the workshop. This is the overall percentage of the survey.
Okay, then I think I misunderstood. Thank you very much.
For me, I think I would like to ask about the technical perspective. Can you go to the QR code, please? So personally, I am QR code developer, engineer. So I would like to ask this. Okay. So how you develop your own QR code? Do you buy, do you subscribe, or do you have your own code? Because that will be sensitive to generate the QR code, because we know that the kind of limitation of 3 weeks time, how many times, and so on, unless you have your own tech.
Do you want to test run on our app? We can prove because this app, this QR
I
code.
just it's okay. I just want to know what is the back end of the QR code generator. Could you explain briefly by oral?
We use an app to create this QR code because at first we want to use SFP build app to create, but after that we found that there's an error occur. I also asked for trainer for help, but at the end it doesn't come out. So instead of wasting time, so we decided to use another app to create our own barcode. For the nutritional facts, the source we already stated at the reference page. The most of the nutritional facts we obtain from, like example for this nugget, we obtain from the Ayama's website, official website.
Okay, meaning this QR code is designed by yourself?
Yes.
Okay, thanks. I understood.
So, basically, this is the outcome when you scan the QR code.
Okay, so thank you, judges, and thank you, Team Nutri Warriors. We have come to the end of the first half of the team presentations. We will now be going for a short break. So please help yourself with the coffee and tea outside. We will resume with team presentation at 11 a.m. Right. Please. Okay. Because we end it earlier. So we need to proceed it earlier or we just follow 11? Yes, okay. 11. 11. Okay, so please.